Mr. Courtney is recognized for 5 minutes.
Thank you, Mr. Chairman. Mr. Chairman, when a new Congress is sworn into office, each member is given a PIN, a voting card, and accessibility to the Federal Employee Health Plan. What is the Federal Employee Health Plan? It is a government-run, I repeat, a government-run purchasing exchange which provides members of Congress, along with other federal employees all across the country, a choice of private health insurance plans at a much more affordable rate than what exists in the private sector. GAO has verified that with a recent study that shows that cost growth in the Federal Employee Plan has been lower than similar situated group plans in the private economy. And it also operates without the harshness of the pre-existing condition exclusions which punish so many Americans who are on their own in the existing health insurance marketplace. When I listen to the hysterical description of what is in this legislation, I would remind many members to just look at themselves in the mirror, because what they are presently entitled to as members of Congress is exactly what this legislation is proposing to create for all Americans. That's why when I ran for office, I told the voters of my district that I would not take the congressional taxpayer-financed health plan until every American has access, because it is such a galling, bitter pill for Americans to have a situation where they are excluded in many instances from buying health insurance or are punished in terms of higher rates and costs than the people who rule them in Washington, D.C. And that, at the end of the day, should be the measuring stick for how well our product is that we vote on and send to the President. I would contrast that to what I heard back home in the district recently during the July 4th break. A 62-year-old woman who suffered a heart attack at age 54, whose husband lost his health insurance because his car dealership went out of business. She tried to shop around in the insurance marketplace, the patient-driven marketplace, and what she found was that insurance companies wouldn't even talk to her when they heard about her heart condition. When she went to the high-risk pool, which exists in the state of Connecticut, to buy a health plan, the quote that she got was $30,000 a year to get health insurance, and that's what we have today in the status quo. She would love to have the ability to do what members of Congress do, which is to be able to buy their insurance through a purchasing exchange at an affordable rate. Blue Cross in the state of Connecticut just announced its rate increases in the individual marketplace. 32% increase request that they've submitted to the state of Connecticut's insurance department for individuals, the individual market. Can you imagine what would be happening in this Congress if we had food prices going up 32%, energy costs going up 32%? But for some reason, we have individuals who want to defend the status quo and saying that it's too soon, that we should not move yet in terms of reforming the health care marketplace when we have markets that exist for individuals in this country that are looking at 32% increases. I would contrast that with my visit to the Navy base down in Groton, Connecticut, where we had a Congress on the corner, and I had active duty sailors and military retirees coming up to me and asking me, is President Obama going to take away my TRICARE? The government-run plan that provides health insurance for our military and for eligible military retirees is just great as far as they're concerned. So the notion that somehow what we're doing is scary and going to hurt people by offering exactly what members of Congress today are entitled to and giving a public option, which the men and women who wear the uniform of this country presently are allowed to have, is hogwash. What we are doing is using tried and true methods and systems and market principles to spread risk and to eliminate, again, the harshness that presently exists today for people who are out in that private health insurance marketplace by themselves. At the end of the day, the members, when we vote on health care reform, in my opinion, have to be able to look the people of this country in the eye who pay for our health insurance benefits and be able to say what we are providing is as good as what you pay for members of Congress. This legislation does that. It eliminates pre-existing conditions, it spreads risk across a wide pool, and it will provide affordable, real choice to individuals that today, because of the completely out-of-control, unregulated health insurance market, they are denied. And I urge this committee to do what it's got to do in terms of making smart, intelligent amendments tomorrow and the next day. But at the end of the day, we must act, and we must give the people of this country exactly what they give us. And I yield back, Mr. Chairman.
Gentleman yields back. Ms. Shea.